Well, a few moments ago, you heard Congressman Eric Paulson voice his support for the American Health Care Act, the GOP plan to repeal and replace Obamacare. The administration of Governor Mark Dayton is warning of dire consequences for the state of Minnesota if the Republican plan does become law. The state estimates 1.2 million Minnesotans would soon lose or have their health care coverage reduced, and that the state could also lose $80 million in block grants over 5 years for programs like childhood immunizations, lead abatement, and other public health initiatives. Joining us to talk about these concerns about the GOP health plan is Minnesota Commissioner of Health, Dr. Ed Ehlinger. Thank you so much.
Good morning, Esme.
All right, and I think you wanted to stress you're not a politician. Right. You've been a pediatrician for 45 years, but you are the Commissioner of Health in a Democratic administration.
That's right. And as Commissioner of Health, I've noticed that our conversation about the AHCA is all about the insurance piece. You know, Medicare and Medicaid and insurance plans. There's another whole piece of the AHCA which relates to public health. A lot of public health dollars are embedded in that. And if we do away with the ACA, all of that money goes away. And those are the things that you said impact immunizations, relation to infectious diseases, dealing with Ebola and lead poisoning. Those are the things that really keep people healthy. And that's what we need to focus on if we're actually going to get out of this problem about rising healthcare costs.
All right. And so you're saying that you estimate that under the GOP plan, Minnesota would lose $80 million over 5 years.
That's correct, because much of the public health dollars had been embedded in the ACA, and if we repeal that, those dollars will go away. So we're arguing that those dollars really need to come back in some way, shape, or form. They may not be part of the AHCA, the Republican plan, but they need to be coming from somewhere. Otherwise, we are going to do the things, eliminate the things that have made us healthy, that has kept us safe for the last 30, 40 years.
Well, the Republicans say we want to cut, their plan is going to cut $330 billion plus from the federal budget in 10 years. So it looks like they're looking at those cuts. I mean, can the state make up for it, do you think?
Well, this is the kind of the funny math that's going on. Yes, the federal government will reduce some of their costs, but they're going to be shifting those costs to the state, and they're going to be shifting those costs to particularly seniors and low-income folks. So that is going to be, it's not going to reduce overall costs. It may reduce costs in one budget, but it's really going to cost the state and individuals a lot more. And traditionally, public health has been a partnership between the feds, the state, and local government. And so all of those pieces of that three-legged stool have to be there. It's been that way since 1921 and was reinforced in 1935 and again in 1964 and again with Reagan in 1981, that the federal piece is really important, the state piece is important, and the local piece is important. The AHCA eliminates one part of that three-legged stool.
All right, let's talk about what's happening with community health centers across the state of Minnesota, because this is actually a crisis that's looming, and really it has nothing to do with the Republicans, because it would have happened anyway. $22 million worth of grants is going to be lost on October 1st to 17 community health centers across the state. Many of them are in rural areas. They are the only health care center that people have. How concerned are you about that?
Well, I'm concerned about access to care, because that is really important. We know that true access to care, to be able to get to care and get care, is important to health. And the community health centers, along with the Planned Parenthood clinics, which are in some of the areas of the state where there are no other health care providers, those all are threatened. And if those go away, people don't have access to care. And it's going to have impacts in their health, both short-term and long-term.
All right. How are you planning for this? Because there's so much uncertainty and there's so many moving parts, and some of these things could happen very, very soon. Well,
certainly we're working at the national level with the Association of Health Commissioners, really arguing and making the point to Congress people that you really have to pay attention to the overall health. You have to pay attention to the public health system. So we're making those efforts to educate folks. Most of the people don't recognize that there's a public health implication to that. So we're really working with a lot of our partners to do that. We're also looking here at the state level to say, the governor says, you know, let's hold some dollars back to find out what happens at the federal level, because if we have some major cuts, the state is going to have to step up. So we're working with our Republican and Democratic people in the House and Senate in Minnesota to do that kind of planning, just in case the worst thing happens. The positive thing is that this is not done yet. I think there's a lot of controversy both about the president's budget and about the AHCA that I'm hoping that cooler heads will prevail and we'll really choose the things that actually make people healthy and keep them safe.
All right. Well, Dr. Ed Ehlinger, thank you so much for your time this
I
morning. We
appreciate being with you.
Thank you.